Hi, everybody. Welcome to We Can't Do This Alone. I'm your host, Erin Stitzel, and it's always a great day on We Can't Do This Alone when we have a physician with us. And today we have just that. We have Dr. William Hicks. He is the Vice President for Neurosciences and a vascular neurologist at OhioHealth, which is a huge healthcare system right here in Columbus, Ohio, where this show is based. And we also have the Vice President of Philanthropy for OhioHealth, Simon Bisson, who is a friend of mine. We are so excited to have them on the show today to talk about how partnership between Dr. Hicks and Simon and the foundation has really helped transform stroke care here in Columbus, Ohio. And before I turn it over to Simon and Dr. Hicks to introduce themselves, I will just say, kind of as a rule of thumb here in healthcare philanthropy, we talk about physician engagement. You might hear somebody like me say the 3 C's. We talk a lot about cardiac, cancer, children's. And, across the country and working with our clients, I'm usually working in those 3 service lines, which is why I'm so excited today to have Dr. Hicks and Simon talking about neurosciences. Although I also will say increasingly, we have been working more in neuroscience when we're working with foundations across the country around partnership with philanthropy. So I hope everyone will take note this morning as we talk to Dr. Hicks and Simon about neurosciences and partnering with philanthropy. So Dr. Hicks, Simon, welcome to the show. We're so happy to have you here.
So happy that you decided to have us. Thank you.
Thanks, Erin.
Absolutely.
Great to be on the show. Always happy to talk about physician philanthropy partnerships, and big fan of the podcast so far.
Well, thank you so much. So before we get started, let's go ahead. I want to let you guys introduce yourselves. And Simon, why don't you go first and introduce yourself, but also tell us a little bit about OhioHealth.
Thanks, Erin. So as you said in the beginning, OhioHealth is a network of community hospitals based here in Columbus, Ohio. We have 16 hospitals in our network. And Ohio encompasses about 88 counties, and OhioHealth has a presence in 55 counties, so a large service area. And we have a flagship hospital called Riverside Methodist Hospital here in Columbus, and a number of hospitals spread throughout the state. So my role at the OhioHealth Foundation is to lead our fundraising enterprise. And as we all know, that involves working with donors and physicians to bring resources from the outside in the form of charitable gifts inside our network to benefit the various programs, services, and projects that we offer to our patients and their families. A little bit about my background. I've been in healthcare philanthropy for about 15 years now. This is my second large health system that I've held the role of vice president in, and love the work. I love igniting donor passions and matching them with institutional priorities. So thanks again for having us. And Dr. Hicks, I'll kick it over to you.
Appreciate that, Simon. I am BJ Hicks. I am a stroke or a vascular neurologist. That's a neurologist that focuses on stroke care. And my clinical training brought me to OhioHealth and specifically Riverside Methodist Hospital in 2012 to really help grow and turbocharge, dare I say, the stroke program there. Stroke is a team-based approach to care, which is what I've always loved, and it's what I love about my current role in neurosciences, and also my interplay with Simon with philanthropy. But it's really working as a team to take care of a devastating condition that happens at the turn of a dime or drop of a hat or whatever euphemism you want to use. And we have been very proud of the care that has been done in the world of stroke in OhioHealth and Riverside in particular. And I think we'll talk a little bit in a little while around what we did to really be bold in stroke care and to bring it not only within the 4 walls of a hospital, but to get the care started far before that, and we really relied heavily on philanthropy for that. I personally am a child of Columbus in Central Ohio. I grew up here. My family has lived here in some form or fashion since the 40s. So grandfather, father, and my family, as well as myself raising my kids with my lovely wife. So love this town and love OhioHealth.
Well, and anybody who's been to Columbus, who's driven up 315, you see Riverside Methodist Hospital. So if you're ever in Columbus, you cannot, I mean, it is truly, it's a phenomenal institution that I personally drive past multiple times a week. So it is huge, and I'm so excited to dig deeper into the care you guys are doing there. Well, and Dr. Hicks, let's talk about neurosciences. I mean, I brought up at the beginning, this is a service line that I personally am learning more about in my own work as time goes on. Why is neuroscience so important now?
Erin, I loved how you started us off talking about the 3 Cs, because in training, we as clinicians always notice that. And we said, boy, there's a lot going on in neurosciences. There's a lot of problems we have yet to solve in stroke and other aspects of neurosciences. And when is the world going to get interested in solving these problems? And then here we are in the midst of the silver tsunami. So we've got over 11,000 Americans every day turning 65. So this is now front and center, not only for the baby boomers who are turning 65 and above, who had witnessed neurological conditions and memory conditions, especially torment their loved ones and their elders, and the concern is to make sure that this does not happen to them as well. And furthermore, we have younger individuals who also have noticed this as well, and they want to make sure that we are prepared not only to take care of our current elders, but to take care of individuals as they enter that stage. So I think we're at the opportune time for individuals to start thinking about how could we advance neuroscience care, because there's a lot of really innovative and dynamic things occurring to try to counteract a lot of the conditions that we take care of in neuroscience.
Well, and I love that you said that. I mean, I personally, if you think about stroke, it's kind of like you don't think about it until it happens to somebody you love. And then it's the worst possible thing that can happen if it's a horrible stroke. Yes. And so it's kind of, it's not top of mind to everybody, so to speak, until it happens to you, right?
Absolutely. And time is everything. When it happens, it is devastating, of course. But if you act fast enough, you can reverse those symptoms. The large majority of stroke cases, if you get to them in time, you can reverse the symptoms. So that's why we really work hard in the stroke community and in OhioHealth and at Riverside and our other centers to really let the surrounding communities know that time is brain, and we need to do all we can to make sure that you're getting expert level medical care as soon as humanly possible. Now, afterwards, we will do all we can and try to figure out why it happened and make sure it doesn't happen again. But the rate limiting step, as we say in science, the biggest thing to do is, if it's happening to you and if you're able to, or if there's anyone within view, dial 911. Let's get going to try to reverse the symptoms from becoming permanent.
Well, and I'm going to ask you about innovation in a second, because I know that's really important. Let's first talk about how you and Simon began working together, because then we're going to get to the good stuff, right? About what you guys did together. And Simon, you've not been tell everybody how long you've been at OhioHealth. I know you came down from Cleveland, which unfortunately, both you and I are Cleveland Browns fans. We have that in common, and so you're here now in Columbus, probably still, unfortunately, rooting for the Browns. But talk about, your arrival at OhioHealth, and how did you start working with Dr. Hicks?
Sure. Thanks, Erin. Yeah, today I am a proud Buckeye fan. The Browns are kind of on their own, but we root for the Buckeyes here in town. So I joined OhioHealth a little over 4 years ago. And there'd been a lot of fantastic work done in philanthropy prior to my arrival, and a lot of huge investments made, for example, in neuroscience before I got here. For example, we have a dedicated tower, a neuroscience tower here at OhioHealth. We have an awesome neuro wellness center here at OhioHealth. We'd established, and I can't wait for Dr. Hicks to talk about how the mobile stroke program was established before I got here. But what I realized when I joined the system was that there is a tremendous amount of opportunity for us to work together in the service line. And as mentioned earlier, our population is getting older and sicker, right? So that means that there's going to be a lot more people seeking out our services. And part of our job as philanthropy leaders is to build relationships outside of the hospital, so that our community, our patients, and donors get to know us before they need us, but then also build relationships inside the hospital so that the partnerships that we have with physicians are strong and built on trust, credibility, and respect. And so as we begin to work together and say, okay, there are things within the system that need philanthropic investment, there are donors and patients and potential donors outside the system that may have an interest. The way that we work together as a physician and philanthropy leader partnership is really important. And it begins with, in these are my words, being curious. Tell me about the work you do. Help me understand what neuroscience is all about. Show me your work. And so we spend time getting to know our physicians, visiting them at their care sites, in a clinical setting. We visit, for example, with the whole team, the mobile stroke program, and get to understand its value, meet the people there, see the incredible passion that they have for their work. And then as we are talking with donors and potential donors, we're trying to relay that passion and invite them to join us. And then I get to partner with Dr. Hicks and his colleagues, and let them take over. Really, our work at that point is to step back and let our clinicians shine. And not every physician loves fundraising. We know that. But what I do know is that our physician partners love to talk passionately about their work. And so it starts with being curious, help me understand, and then it's an invitation. Come and talk to groups, individuals, or foundations passionately about the work. And I think that's where it begins. It's that curiosity at the beginning, and then an invitation to share your passion and vision for the work. And that's how we began to work together.
Well, and Dr. Hicks, I mean, you do love philanthropy. So that's a good thing, but I love that. And two, I mean, Simon, what you just said, you nailed it as far as matching their passion to get the donors and the patients to the table. I mean, you've got to do just that, but then letting Dr. Hicks and other physicians let that and share what they're doing. So let's dig a little bit deeper. So talk about, and either one of you can answer this, what project did you work on together? And, Simon, I know you mentioned you did have mobile stroke before you arrived at OhioHealth. So maybe Dr. Hicks, do you want to share a little bit about that program quickly before we kind of move on to the magic together?
Sure, and thank you, Erin, for saying quickly, because when you talk mobile stroke, I can spin some yarn. I can go on and on and on, but I will do my best to keep it succinct. When I was in training in Houston, Texas, my mentor was Dr. Jim Grata. I called him the godfather of stroke, and I learned so much from him in ways he has no idea. Part of which was he was very adamant about cutting edge stroke care at the beginning of the disease. Get there rapidly and try to do all you can to open up the blood vessel or to do things to, on the front end of the stroke in progress, do all you can to try to reverse it. And so when mobile stroke as a concept came about in Germany, we all knew that that Houston would be the first in the United States, and that's exactly what happened. But while he was adamant about being about cutting edge initial care, he also let us trainees, fellows, if you will. He made sure the fellows were also always talking to EMS providers who drop the patients off and say, they are key parts of our team. They have to understand that. They have to really feel the importance of having a team-based approach with our stroke team specifically. He also was always by himself as the chairman. He was working with Philanthropy and making sure that they were understanding the vision that he had. So with those two things were really important for me to learn. And fast forward when Houston became the first in the country to have a mobile stroke treatment unit, and I told it to my administrative team at the time, this is the future of stroke care. They were all interested in how can OhioHealth be part of this. And what was really, really impactful was that because it was such a new and novel concept, you were not having payers. You were not having how you typically get reimbursed in healthcare. That was not a part of the play. So you really needed Philanthropy. And this is where an innovative concept that our payers or the government hasn't quite caught up to yet, this is where you really need strong engagement with Philanthropy to have them understand the why and the problem we're trying to solve, and how working with Philanthropy, the great stroke team at OhioHealth can collaborate with the philanthropic arm of the organization and provide to the community that we all love a cutting edge stroke treatment to benefit our human beings that live around here. And so that was just the beautiful marriage and how mobile stroke came about. It was the connection with our EMS providers, connection with Philanthropy to have the financial backing of this, and with our stroke team to help evangelize it. And I just loved how it wasn't just a me thing. The team that we built, and Simon talked about the mobile stroke team, it goes back to that "you win with people" Woody Hayes quote, because when you get the right people that are doing that work, they become the evangelists themselves, and philanthropists and potential philanthropists, whenever they are around those individuals, it becomes infectious.
Simon, anything to add?
Yeah, I want to touch on why this particular project is appealing to our donors. And you mentioned the 3 C's, which many of our donors, even lay people, kind of understand. Neurosciences is not always easily understood by people who haven't experienced a neurological condition. But what made this mobile stroke program attractive to donors is they can see it, and it's very visible. Essentially, it's a big truck crammed full of very expensive technology. That if you're talking to a donor about time as brain, or a patient about their experience, what they remark on is the speed with which this mobile unit was able to be deployed and meet them where they were, in a parking lot at a grocery store, in the driveway of their home, on the side of the road. And we've had a lot of success in talking with donors and saying, hey, unlike sometimes where it's challenging to go into an OR and see a surgery and get all the permissions and timing correct, you can come and see this mobile stroke unit. You can visit it. You can touch it. You can sit in the seat. It's kind of like the Touch a Truck program. So donors have reacted really positively when they can tangibly see and touch and ask questions about how this works. And so it's been not only a great community asset, it's been something that we can showcase and show the donors exactly how it works. And when you get a combination of the vision that we have to treat people in that sort of golden hour, plus the opportunity to show them the program at work, right? It for lack of a better term, it kind of sells itself, and it's made for a very popular program with the donors. The foundation was able to contribute more than $500,000 to the last mobile stroke unit that we purchased. And so that's part of what has made this relationship successful.
Well, and Dr. Hicks, so, going back to, so when you first started this program, basically what I'm hearing is you were allowed to dream, right? What I heard you say is, our typical insurance payer way we do things. I'm not an expert at that, but there's no DRG code for mobile stroke, right? And so Ohio Health had allowed you to dream, dare to dream, to bring this to the community using philanthropy, which that is so key. As somebody who works all over the country with physicians and foundations, not everybody's allowed to dream. Other physicians like you that I have worked with have dreams, big dreams. And philanthropy is the fastest, easiest way to bring in dollars to fund something that the community doesn't have. But, if the dream doesn't align with the financial situation of the hospital or the strategic plan or vision, sometimes they're not allowed to dream. So that's why I love this so much. I want to talk about that as far as, obviously, donors had to have been brought to the table. So my first question is, any examples come to mind that you guys want to talk about any specific donors you worked with? I mean, you don't have to name names, but just anything special on that point of view. And then two, I also want to talk about how you guys are working together to steward these donors. And, Dr. Hicks, I know you spend time with donors to this program as well. And so a lot of our listeners are philanthropy colleagues like me who love to hear that. So, let's go first. Talk about, philanthropy making this happen. Any examples you want to talk about? Anything make you smile when you think back?
Well, when you were touching on being able to dream, that hit me right between the eyes, because that was absolutely how I fell in love with OhioHealth. I have to be honest, because I was new in my career. That's not supposed to happen. When you kind of understand, especially in an academic center where there's an org chart and there's a playbook and there's a strong, encrusted, entrenched chain of command. So I mentioned earlier, when the chairman does the philanthropic conversations, it's not somebody a year and a half out after their training that gets into those conversations. But that's the beauty of OhioHealth. If you have an innovative idea, if you have passion, if it makes logical sense, if it's bold and if it's innovative, and if it aligns with the strategy of the organization, that's where philanthropy comes in, and you make beautiful music. And that's what was so exciting about this proposition. And it really propelled stroke care in the community forward. And a lot of my colleagues nationally would ask me, "Hey, how did this happen? Tell me how this occurred." And I kind of tried to give them the playbook. And to your point, maybe that their health system didn't see that vision. They were thinking kind of in a scarcity mindset. Maybe they didn't have inroads with their philanthropic arm. Maybe that health system didn't have the ability to think outside of those 3 C's from the philanthropic side. Or maybe, as Simon alluded to earlier, those docs had big ideas, did not want to convey it, and did not want to take the extra step to go out and evangelize it and get in front of potential donors to do that. And to me, what I love around the whole process is how Simon talked about being in front of philanthropists or donors, and Simon's so great at extracting their why or kind of what is their passion, what is their interest, what would they love to do. And then Simon and I think through this and say, hey, is there a potential avenue in your strategy for neuroscience? Could there be a potential collaboration here? What say you? And we think about it, and then we're able to kind of bring in that philanthropist to explain how their thoughts and wishes can interact nicely with the strategy and the vision of what OhioHealth Neuroscience is trying to do over the next 2, 5, 10 years. And I think that's the beautiful marriage of what Simon and I like to do. And I'm not sure if Simon, you have anything else to add there.
Sure. I would also add, as well as the vision from leaders like yourself, Dr. Hicks, the system has to endorse what we're doing, right? We can't just as much as we would like to sometimes, go out on our own. So it required a lot of internal partnership with the system to say, yes, we believe that there's a gap in care in our community. Yes, we're going to build this kind of field of dreams, right? If you build it, they will come. So the system approved the vision. The physician partners were out there talking about this needed resource within our community. Early donors provided some money to help start the program. And then, and I'm talking specifically now to all of my philanthropy leaders out there, there is no better advertisement for successful philanthropy than having patient testimonials endorse the value of the program. And so one of the things we've done recently is invite some former patients to share their story. And I'll bring up one. Janet had a stroke in a parking lot of a local grocery store. And, thought that at the time, she and her loved ones thought that her life was going to end. It's a very powerful moment when Janet is standing in front of a group of donors telling the story. If not but for this mobile stroke unit or this program, I wouldn't be here today, right? So at that point, the philanthropy leader and the physician need to back away and let the patient talk. Have them share their very personal experience, and then others feed from that. They see the value. They then ask, well, wait a minute, how can I contribute? Well, come and visit us. Come and see the program at work. Talk to the staff who are on the rig, who are called out to serve patients wherever they may be. So now we've shifted into this mode of really inviting patients to give testimony and to share their own personal story. And now they have also become donors, some of them large, some of them small, but it was a very meaningful experience. So I think that is something that we, as the physician philanthropy lead partner, have invested our time on, is inviting patients to tell their story.
I love that. And I love how you meant, donations big and small. Everybody has the right to express their gratitude and make a gift and share their story. How often do you two meet, this kind of like business working relationship, just to share for other philanthropy leaders and doctors out there? What does that look like? Is it monthly, quarterly, or just kind of as needed?
Well, I'll kick off. One of the things I will thank Dr. Hicks, and a lot of our physicians are like this, is they will respond when needed, right? So Dr. Hicks is very approachable. He's very receptive. He's easy to communicate with. We meet probably formally on a quarterly basis to review donor stewardship plans. Sometimes it's the hard stuff, right? Sometimes it's about when things aren't going so well and how do we solve this problem. And then it's as needed. It's a lot of time over text. We all know our physician partners are busy. They are not sitting in their office waiting for the philanthropy team to call. They're treating patients, they're running departments, they're saving lives. And so, I think that only happens once you've established that, look, we're going to do what we say we're going to do. We're going to follow up with you, and we're going to try and use your time wisely. So we meet quarterly, formally, and then as needed in between that. Dr. Hicks, how would you answer that question?
No, you hit it perfectly. But what I always appreciate is because Simon is so gracious with his time in front of the donors and philanthropists, and making sure that he's doing the periodic check-ins, because he, as he alluded to, the physician leaders are busy doing kind of clinically focused things and kind of big strategies and everything in between. So what Simon does, which I love, is say, hey, I'm about to check in with so-and-so. Any updates as it pertains to our previous conversations with this individual. So it allows me to think about it. We can powwow over it over person, or I could send him some talking points or some updates to really ensure that we're all kind of saying the same thing. And he can take that information and feed it back to me. How is that how was that digested? What did they think about it? And how are they thinking about the future? And so it could help us plan for a future meeting with a particular individual or individuals. So that's what I really appreciate, because it allows me to still keep neuroscience top of mind for these individuals. And so we're not just leaving well enough alone and being passive, and making sure that these very important people understand that they're very important to us and to our work.
Do you like, Dr. Hicks, do you like meeting one-on-one with donors, with Simon, or do you like speaking to big groups, or you'll kind of do anything to advance stroke care? What about your personal preferences?
Yeah, you can meet me in the back alley. You could put a mic in front of my, have it at some formal event. It doesn't matter, because we're talking about what I love and what I'm so passionate about, and how we could potentially collaborate for future goals on behalf of our beloved community. So it does not matter either way. I like to get to know individuals on a personal level, but I also like to speak to large groups, because you never know how that resonates with individuals, and it lets them know that it does not matter kind of what's the size of your portfolio, how much you have to give. It all matters. So all these individuals are important if they're taking the time to listen to whatever the heck I have to say about neurosciences. So either or, I'm all for.
And I would add, Erin, and again, I'm speaking to our philanthropy partners out there listening. I think we all know this inherently. You take whatever time the doc is willing to give. So if it's a minute or two walking down the corridor to update them on a donor, or if they're offering their personal time for a dinner or drinks or whatever it may be that the donor would like to do, take it and thank them for it. Just make sure you're using their time wisely, and then report back. What I found is that our physician partners always want to know, hey, what happened with this donor? Where are we with this issue? Even though they're busy and they have a lot going on, I think if you're not following up regularly and using their time wisely, you'll start to see their enthusiasm drop off, right? Maybe now they're not so available. But if you are always upfront with your communication and you follow through, then I think there's a willingness to continue to partner together.
Well, I couldn't say that better myself, Simon, as a physician engagement consultant. So you took the words right out of my mouth. And I too, Dr. Hicks, I mean, your passion shows. And so many times I'll tell folks, if the doctor doesn't care about what you're raising money for, they're not going to do it. So that probably resonates, right? I mean, clearly you're very passionate about this, and you were allowed to dream, and that's so cool. And so obviously you're much more motivated to help with philanthropy, right?
There's no maybe about that. This is what it really is the lifeblood of innovative initiatives, because even a forward-thinking, innovative health system like OhioHealth, they're going to want to really kick the tires and really think long and hard about an initiative that might be a bit bold and a little bit out in front of others. And so they're not going to green light everything that I have on my wish list. And there's a lot of things within neuroscience that do bring back a high amount of revenue to the organization or to a hospital. And then there are other things that might be considered in a nice to have bucket, but there's a strong community need, and there's a strong kind of future facing need. And that's really where I like to think about our people really need this, and philanthropy can understand this, and it can help propel OhioHealth forward with this collaborative relationship with philanthropy. That to me is really checks all the boxes for health system, philanthropic support, neuroscience service line direction. That's really where philanthropy lands the best in healthcare, in my estimation.
Absolutely. Well, and before we wrap up, I want to touch on your own personal philanthropy. I know philanthropy is a big part of who you are and your upbringing. It kind of shaped who you are. Do you have anything to share about that? Just kind of how that has shaped who you are and the things that you do today.
Yeah, people think very people are very passionate about community, and Columbus especially is a strong and a very passionate group of citizens. My family's been here since the 40s, as I mentioned earlier. My grandfather was a pastor, and so anyone that pastors a flock in a particular area of town for a long period of time, you are stretching out and you are uh, talking about the importance of helping your fellow man and woman. So that is just an infectious way. And then with any sort of church-wide initiatives, you are by definition entering into philanthropy in that form or fashion. So it just really sharpened everyone in our family into thinking in that way. My father left for school and training, came back and became a physician. My mother was very, very active in the community and did a lot of philanthropic and nonprofit work over the years, and she continues to do that. And thankfully, I married my wife, Nikki, who really feels strong about this, and we both want to pour that worldview into our children and make sure that they're being a part of this. So the adage of time, talent, and treasure for philanthropy is a critical importance to myself, but more importantly to my nuclear family and to my extended family as well, because that's really the point. You want to make it infectious. You want people to feel like this is inclusive. It should not be exclusive. This should be for the 0.1 percenters. Everybody can give, and that's what I always like to let everybody in on.
Absolutely. Well, and I'm so glad we had talked before we started recording. I'm not from Columbus. I've been here 25 years, but Columbus is one of the most philanthropic communities I've ever seen. And I've seen a lot of communities all over the country. So I consider it such a blessing to live here. And thank you for all that you're doing to pass that on to your children. So it's so cool to be here.
Appreciate that.
Okay, well, we're going to wrap up. However, I do have the one last question. So this is a podcast called We Can't Do This Alone. We cannot do healthcare philanthropy without our physician partners, without our physician leaders like Dr. Hicks. So Simon, you've already given us several really good pieces of advice, but I'll ask you one last time. As a philanthropy leader looking to either start or improve building relationships with physician partners, physician leaders like Dr. Hicks, clearly you have succeeded at this. What is your one best piece of advice for other leaders or philanthropy colleagues like you?
Thank you for that question. I would summarize it in using the letter P. So we talked a little bit about physicians. We talked about philanthropy. The first P is partnership. It begins with the partnership, that trusted relationship you form with your physicians and invite them to be partners in the work. And from there, you build that partnership and you develop a pipeline, right? A pipeline of existing donors and potential donors. And then the third P, and you heard this a minute ago, is passion. You got to have passion for the work, right? And when you have strong partnership, you have strong pipeline, and you have a lot of passion, then the moment where you're asking for that donor for their philanthropic investment gets a lot easier once you've got that solid bedrock of those three ingredients. And so that's how I would answer that question. You need a lot of passion, you got to have strong partners, and you got to have a robust pipeline.
Absolutely. Absolutely. Well, and Dr. Hicks, I'll ask you the question kind of two-prong. First and foremost, what is your advice for other philanthropy leaders like Simon when it comes to approaching, building relationship, and working with a very busy, passionate doctor like yourself?
Well, Simon's got it all down, so he's the subject matter expert. But to anyone else that potentially could be trying to fill a Simon shoes or who are aspiring to be a Simon one day, I think the key is to myself as a service line leader, that's a great start because that's kind of part and parcel to what you are charged to do as a leader of a service line. And so that's a great first step. But the key is to engage not just the service line leader, but those subject matter experts into those subspecialties. So when you find that donor that says, psychiatric services, suicidality, that's what I want to eradicate. I want to take care of men's mental health. That is a concern of mine. I want to take care of addiction medicine and the struggles of that. I want to take care of movement disorders and Parkinson's disease. I lost a loved one to ALS and I want to help there. I want to deal with cognitive impairment and Alzheimer's. We can do better in this space. Any of those sorts of things and scores more within neurosciences. It's one thing to hear from me time and time again on these different topics, but it's really impactful and it really resonates so deeply when we find a physician who's close to that work and who's doing it day in and day out and can, and as Simon alluded to earlier, can just talk about their work and the passion just spills out naturally. And so that I think is the secret sauce. If there is a leader who can give the broad brush overview and help in a pinch, but when it's really time to have something resonate, you bring in that physician who may not want to be there time and time again, but in a targeted environment on a targeted topic can really bring the message home and secure the relationship.
Thank you for that. And on the flip side, to your physician colleagues, what would you say to other physicians out there, who could be young and new in their practice or more tenured, but maybe be apprehensive about working with philanthropy, or they just might not know about it, or it might scare them a little bit? What advice would you give them?
That's an excellent question. I would say to feed the mission that you're passionate about, you're going to need partnerships. You cannot do this in isolation. And oftentimes, the organization by themselves may not get there, as you alluded to earlier, Erin, may not get there as quickly as you would like. And so if you feel passionate about something, if you understand it might be bold, you're going to have to take the next step and engage in this manner. And it doesn't mean that you're going to bat 1,000. A Hall of Fame major leaguer, bats 300. So it might take a couple initiatives. There might take a couple times to it. You might have various events and we don't get to where you think is successful. But if it's critically important to you, if it's something that you're passionate about, if it's something that your service line believes in as well, it's well worth your time. So I think that's really the strong message, and it usually lands very well. The docs understand that that there's a long, proud history of medical innovation thanks to philanthropy. So it's just engaging them and kind of reminding them of that a little bit. It also sets the stage for them to be future leaders as well. And so docs typically step up to the plate when given the right opportunity and kind of explaining it in a certain way.
Well, I love that you said that, because that has been my experience in 20 years. Again, I've mentioned last week's episode how much, working with physicians has been just the most impactful part of my career, because physicians have been the most generous, the most passionate, and you make the absolute best allies in healthcare. And thank you for reiterating that. Anything else to share before we wrap up?
Erin, thanks for doing this. I wish you every success, and I really appreciate you having us on today.
What a phenomenal topic to discuss in more detail, and it's something that is not often said aloud, so I appreciate the opportunity for Simon and I to expound on this further.
Well, I love that. I cannot thank both of you enough for taking the time to come on the show. You just said it, Dr. Hicks. I mean, a lot of point of this podcast is to talk about some of the things that we don't always get to talk about. And I think we did that just yet. And so again, I cannot thank you enough. I mean, talking about the importance of dreaming and the passion fueling a project. And then Simon, your expertise, and Dr. Hicks, your background as a philanthropist and just your passion in bringing this innovative care. I feel better being a Columbus resident, knowing that this will be here for myself and my family one day. And, maybe we can share this with others. So Thank you so much to our listeners. Thank you for being here today. Again, this is We Can't Do This Alone. I'm your host, Erin Stitzel. We are so thankful that you're here with us, and we look forward to you joining us again next week. Thanks so much for coming on the show. Thank you all.